when they started the language training and the focus groups that they did, what they realized is when people say, you know, I'm Greg Williams, I'm in recovery, the general public believes that, you know, I'm trying to stop. That's just what that word means to them. And the story and the narrative that really hasn't been told is that people like me and have, you know, I haven't used drugs or alcohol in over 12 years. And there's there's millions of other people out there who haven't used drugs in 20 years, 30 years. And it's really that face, that story, that narrative hasn't been told in our culture, that people can get well, and not only just get well, but well for a long period of time, and their lives get so much better maybe than it ever was before in terms of giving back to their community, taxes, starting a business, going to school. Like, all of those things really are powerful. And so to really show that side of the addiction story, it was really important to highlight that other side of the story.
They're not treated like normal citizens. They're not treated like normal people. They're not like us. But you know what? I'm one of them. And a lot of folks up here are one of them.
In the 40s, 50s, and 60s, we had people advocating for addiction treatment. And what that looked like ended up being these 28-day programs where people would go away. You know, Joe or Bobby's going to treatment. They're going to come back. They're fixed. They're no longer an alcoholic. And what we realized is that system that we developed, while, you know, it supports early recovery, maybe it initiates recovery for some people, it's not really the nature of the illness. This is a chronic illness, and that's an acute care model. And so we have to really start to stretch our systems in a way that people have ongoing support services and more chronic management of those. Very similar to type 2 diabetes or you know, asthma, or even some heart disease. It's not very different, where there's huge, you know, behavioral and lifestyle choices and changes that need to be made to manage those chronic conditions. And those, you know, somebody type 2 diabetes, they get a nutritionist, and they go see their doctor, and they get readjusted, and they change their diet, and they do all these things, and their family and their community supports them in making those changes. And so addiction, it's really no different. While somebody might need an acute intervention to get them on the road to recovery, they also need that pathway and that journey to continue to be supported in their community.